we had not gone through the pandemic and gone through lockdown, would the NHS, in your opinion, be in a better place than where it was before the pandemic, or actually would it still be on this downward trend?
Well, thanks for having me on. I think the NHS, if it hadn't gone through the pandemic, would obviously have been in better shape than it is now. But it's not just the pandemic. The truth is that waiting lists and waiting times were rising well before COVID-19 appeared in Britain or the world. So there's something going on in the system. And I would say, look, I've been around health and health policy for around 30 years, and I've never known the system in as much turmoil as it is today. And your viewer who talked about staff burnout is absolutely right. We've got massive staff shortages. People are exhausted, demoralised. And not surprisingly, they're dealing still with COVID. They're dealing with the unknowns of long COVID. We've got a mental health crisis in the country that we've never seen before. We've got waiting lists at unprecedented levels. So we've got a really big problem here. And the truth is, in order to deal with it, you need three things. You need the right level of resources, including the right number of staff. You need a good plan to be able to drive change forward. And then you need the right sort of changes in the system to make sure that the staff at the front line can do their job. And right now, I would say that all three are missing.
Well, I can't help but feel like we've got an abusive relationship with our NHS, to be honest with you. We've got a thing here that every single person that you speak to agrees it needs reform. It needs some kind of root and branch reform. Every single person agrees that it's not really working at the moment. And yet, as a nation, we're not able to have a sensible conversation about exactly how we reform it. We can't keep pumping cash into it. What would some form of privatisation or something like that actually do? It just seems to me like we're all banging our heads against a brick wall, yet we can't have a conversation about how we actually sort it out.
Well, we do need a grown-up conversation, and I hope that the politicians are able to engage in that, importantly, with the people working in the system. Because, look, the truth is, whether you're the Secretary of State or not, you don't deliver one iota of care. That happens at the front line, right? That happens from the doctors, the nurses, the porters, the cleaners, and the managers who actually run the system locally. And far more has got to be done, in my view, to give them far more power and far more say in the system so that they can get their local services properly attuned to the needs of their local communities. So have we got enough money going into the system, health and social care? The answer is we don't. So we need to address that as a nation. We're going to have to put our hands in our pockets in order to be able to do that. But secondly, I can tell you from bitter experience, you can have all the money in the world. And when Labour was in office, we put a hell of a lot of money into the NHS. But money alone doesn't do the trick. This is where the reform agenda that you mentioned, Patrick, is so important. And from my experience, waiting lists only really began to fall. And remember, they were at 18 months when we started as a maximum. They fell down to a maximum of 18 weeks. That only happened because reforms were put into place to make the system far more transparent, to bring in, yes, more competition, to make sure that patients had more choice, and to ensure that the system was pulling together. So these things, they're not impossible to do. There are levers that are available that can be pulled. The problem is, right now, no one's pulling them.
Yeah, and figures came out yesterday, I think it was, from the World Health Organization showing levels of obesity across the world. And I believe we were the fourth most...
We're going to be the fat man of Europe.
Yeah, absolutely. And, where's the role of personal responsibility in all of this? Because, look, a large number of people in this country have very poor health. We have high levels of obesity amongst... Patrick's showing me my cupcake that I was eating in the break. But we have high levels of obesity, and children have high levels of obesity increasingly as well now. A politician probably needs to stick their head above the parapet and say, look, you're going to have to start taking your health into your own hands more so than ever before, just to prevent what can be prevented. But, of course, there are diseases that can't be necessarily prevented. But who's going to stick their head above the parapet and say that?
Well, you're right about personal levels of responsibility. We all have a responsibility to ensure that the food that we eat, the exercise that we take, the lifestyles that we choose are getting the right health outcomes. But here's the thing. We know that 1 in 3 patients that are in hospital today should never, ever be near a hospital. And that should give us grounds for concern, but also grounds for optimism, because it means that if we're able to intervene earlier, to do the prevention in the way that you've just described, Mercy, then we should be able to decrease the level of pressure on the system. So that means there's got to be a lot greater focus on public health, on these appalling health inequalities that were so badly exposed during the pandemic. Remember, if you lived in a poor area, you were twice as likely to die from COVID if you got it than if you lived in a wealthy area. And that's not just about health, it's about housing and jobs and opportunities for people. So when people are talking about health, yes, personal responsibility, but also collective responsibility as a society to deal with these fundamental issues of fairness and equality so that people have the opportunities to lead a decent and healthy life.
Would any form of privatisation or introduction of some kind of private capacity, I suppose, happen under the current Labour Party in the way that it happened under you, in the way you were putting forward?
Well, I would hope so. I think Keir Starmer is obviously bringing Labour back into a much more sensible position than his predecessor. So that's good news. And I would hope that any government, whether it was Tory or Labour, wouldn't succumb to the ideological extravagance of rejecting the role of the private sector. You've got 5 million people waiting for a hospital operation, rather, and rising. And if we can use private sector capacity to treat NHS patients alongside NHS hospitals, that makes a huge amount of sense, doesn't it? So I would hope so. And I think the one thing to be really positive about in this conversation is that, you know, if you look at the huge advances in technology that we're now seeing in the world of healthcare, data analytics, artificial intelligence, genomic science, if you can bring all of these things together, then we can not just reduce the waiting times, but we can also do what Mercy was talking about earlier, which is we can intervene earlier and we can do more prevention and we can target and identify the people who are most prone to particular forms of disease and get in far earlier so they never need to be in a hospital waiting queue.
But is there not this issue with this sacred cow business, right? So can a Labour leader now really stand up and even say this kind of stuff? You've got some howls from the backbenches. You can hear it from maybe towards the left of the party. Some howls of some people who perhaps don't know as much about the health service as you do, for example, amongst the British public, who just hear the word privatisation and think the devil, basically.
Well, I think there's privatisation and privatisation. I mean, honestly, if it's about forcing NHS patients to pay privately for their treatment, that's a different kettle of fish. I mean, certainly what I was trying to do and what I would hope that any sensible government would do is look at the capacity that's available, whether it's public sector, the NHS, or private sector hospitals, and say, right, OK, what we're going to do is we're going to spend public money on utilising that capacity to treat NHS patients for free, according to NHS principles. It's about your need, it's not your ability to pay. That's a sensible thing to do. And it's foolish, in my view, to decry that. It's foolish to describe that as privatisation. It isn't. It's about making available resources to treat NHS patients so that they can get home, get on with their lives, be free of suffering and be free of pain. So, look, I don't know what Keir Starmer is going to decide as he goes into making his manifesto for the next general election, but I would hope that those type of approaches are something that he would contemplate, just as I would hope that Sajid Javid, the current Secretary of State for Health, the Conservative Secretary of State for Health, would do the same.
I'll tell you what we're going to have to do. I'll tell you what we're going to have to do is, as and when that manifesto does come out, I would love to have you back on to critically analyse, maybe praise, hopefully, we'll have to wait and see, what Keir Starmer's views on the NHS are, and indeed Boris Johnson's as well. I think you could be our NHS facts checker. There we go. Thank you very much, Alan. Great to have you on the show.
Promotion, at last.
Good stuff.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.